Welcome to the UMC Trauma Center. My name is John Fildes and I'm the medical director, and I'm here today with Allison Anderson.
I'm the clinical nurse specialist for the trauma department, and we're just going to give you a quick tour through our trauma center here at UMC in Las Vegas.
I want to tell you what's unique about UMC. It's one of the few standalone trauma centers in the United States. The only one of the ones that are similar are in Baltimore, Maryland, and in Memphis. Standalone means that we are not in the main hospital building and we're not in the emergency department. We're in a separate building on UMC property where there's a purpose-built trauma center with everything you need to take care of injured patients. Yeah. We're going to come on in. There's two ways to get into the trauma center. One is here through our ambulance entrance where we have a decontamination room for patients, and the other's on our helipad. We'll show you that a little bit later. This trauma center is 22,000 square feet. It's a little bit bigger than 4 basketball courts. Think about that compared to any emergency department. The security system here keeps us inside of a safe zone, and patients are going to roll in through here and go into what we call the resus area. I'm going to lead you down there.
So the main desk here in the trauma resuscitation area is where EMS calls in and gives us the most updated information about the patient, and all the information gets out to the team here at UMC Trauma.
So our trauma center has 11 resuscitation beds. 4 of them are for fresh arrivals. These are radiolucent hard beds. We then have a procedure bed, 4 observation beds, and 2 ICU beds. All of them can take patients in a disaster, and we've filled as many as 18 patients in here at once. So these beds each have different capabilities. We can do up to and including opening a chest and doing open heart massage or cardiac repair in this bed. Allison? And
easily right next door we have our medication and our lab capabilities. Blood bank available for extremely quick access to transfusion when the patient needs it.
In fact, we can go up to 30 units of blood on the spot. We also have a satellite laboratory that's in this area so that the lab technicians draw and process immediately. The other interesting thing is, since we're a pediatric trauma center, bed 1 is purpose-built for pediatric patients. We have all of the size appropriate equipment, and whenever a pediatric patient comes, we have our pediatric emergency physicians and nurses come down and join us, and the pediatric ICU open up a bed for the patient. We have digital capability in radiology for plain films, and Allison's going to show you our CAT scan suite.
So follow me right to the CT scanner. As you can see, it's just a couple of steps away from our resuscitation bay. It allows for easy, extremely quick access to diagnostic imaging.
It has the added benefit of that we don't compete with other patient needs in the hospital. The trauma patients come first, and this CAT scanner is exclusive to the trauma center. When we get a patient by helicopter, they land up on our roof, and we have an elevator that drops down into the resus area and delivers them. Whether you come by ground or you come by a helicopter, when you're activated, our entire trauma team is present, and we're dressed in protective OR gear, and we're ready to start treating the patient prior to arrival. The activation team is composed of attending trauma surgeon, attending anesthesia doctor, as well as a group of nurses, technicians, and residents, and it numbers 11 in all. It's a little bit like a NASCAR pit crew waiting for a car to come into the to be seen and to be attended to. Everybody knows their role, everyone knows their job, and we get right to work as soon as patients touch down. This is our Angiography Suite, and it resides here in the resus area. We use this for patients who need catheter-based interventions for trauma. It's part of our mission to train residents in emergency medicine and in surgery, as well as internal medicine, pediatrics, and we train nurses and paramedics to train here with us as well. In the past few years, we have a training program now at the U.S. military, and we bring Air Force personnel, both pre-deployment and between deployments, for sustainment of battlefield readiness. When patients come and they need immediate surgery, we can move them directly from the resus area to our operating room. It's a little less than 35 feet away. I'm going to show you where that is now. This is our operating room suite. We have 3 rooms, 1, 2, and 3, and they're equipped to do abdominal, thoracic, orthopedic, neurosurgery, vascular, and even pediatric surgery. We've even done heart surgery in these rooms. And then this leads right into our ICU. so the patients can get their critical care immediately post-op. We're going to show you our trauma ICU. It's integrated with the trauma resus area in the OR here on this one floor, 20,000 square foot layout.
So here in our trauma ICU, we have 14 beds where we take care of the most severely injured patients in all of Las Vegas. It's dedicated specifically to the care of trauma patients, and the nurses and doctors who practice here have specific training and experience in taking care of these patients.
You know, we're proud of the fact that if a patient arrives alive at UMC, 96% of them will go home. Well, you never know when another patient's going to come in, so it's time for me to get to work. Thanks for joining us.
Thanks a lot.